Okay, hello everyone. Welcome to Being Patient Brain Talks. I'm Deborah Kahn, founder of Being Patient. Well, a lot of you by now have heard about blood tests for Alzheimer's disease. Who should take them? What does it all mean? Can it give a diagnosis? Where are we with the technology? So we thought it would be a really good opportunity now to check in and understand where the technology is and where it's heading. So joining us now is Wagner Brum. He is from the Federal University of Rio Grande do Sul, joins us now from Brazil to talk about blood tests. Welcome, Wagner.
Thank you very much. It's very nice to have this opportunity to be here and to talk a little bit about the work we've been doing with blood tests.
So I have a question. The whole blood test now changes the whole landscape for diagnosis or at least identifying at-risk people. So let's just start just very basically. What I know there are new targets and new biomarkers coming on, but as we speak, what do blood tests for Alzheimer's tell us?
So, I mean, I guess as in every area in medicine, we can go a long way to when we have, like, for instance, when we have a clinical analyte that we measure in blood in any routine area of medicine, we can always go all the way and try to think about the underpinning mechanisms and all that. So if we are going to take like the two main classes of biomarkers in fluids traditionally for Alzheimer's, which are biomarkers measuring amyloid and tau in the fluids, these are also the two proteins that are canonically defining the disease. So Alzheimer's is understood as a disease that we have amyloid and tau accumulation in the brain. So, of course, it makes sense to measure these proteins in the fluids. But right now, from a clinical standpoint, what these tests are really good in telling us is whether or not an individual has an elevated level of amyloid in the brain. I mean, the blood biomarkers do more than like for instance, you can say like so a blood test measuring tau tell us about amyloid, but no, there are more nuances to it. Individuals that have more tau in the brain, they will have higher levels of tau in the blood, but the most immediate clinical need when evaluating patients, given the current understanding of disease, is to know whether a patient that presents to you with cognitive symptoms is within the Alzheimer's disease continuum, which is defined by the presence of amyloid. And we know that the blood tests are elevated in people with amyloid in the brains.
Okay, so this is where let's just talk about amyloid right now, and then we'll talk about other bio. So when we say biomarkers, it's the signs of plaque that are in the bloodstream. But I've interviewed neurologists before, and the way that it's been described to me is like, to a certain extent, people have amyloid in their blood and it will cross over to the brain, right? So is there good amyloid and bad amyloid? And what exactly are the blood tests actually picking up on proteins within the plaques, or what are they measuring exactly?
Okay, so uh, okay, if we take these amyloid plaques that we have in the brain as the center of focus in amyloid metabolism, for us to understand the biomarkers, uh, so there is one fragment there is one amyloid peptide that is 42 amino acids long. That is the one that is the most interesting and more clinically relevant within the Alzheimer's field. And what happens is that this peptide crosses the blood-brain barrier and goes into the blood. But the problem is, so amyloid blood tests, they are, I mean, since amyloid was defined as the disease-defining feature of Alzheimer's back in the 80s, measuring amyloid in the blood has always been a big goal in the field. And there have been lots of advances in that area, but what have we found right now? So if you take a spinal fluid test, which the spinal fluid. So basically, I mean, you have your brain and you have the vessels that feed your brain. And let's say that the spinal fluid is almost like the saliva around your brain. So the things that happen there will go there and they will get washed out into the blood. So it's a liquid that bathes your brain. And if you measure this amyloid protein in the spinal fluid in a patient with Alzheimer's that has plaques and compare it to a healthy patient, you will see that it is reduced. And it's a bit counterintuitive in the beginning because most clinical analytes, so we know that having high blood sugar is bad, we know that having high cholesterol is bad, but with amyloid in the fluids, it's the opposite. Having low is bad because it means that it is accumulating into plaques in the brain. So coming back to your question on what amyloid in the blood tells us. So this is the big problem because in the spinal fluid, which is a very clean fluid and it's very valuable for us that work with neurochemistry to measure processes there. You will see that Alzheimer's patients, they have like a very clear reduction in amyloid in the spinal fluid. Let's say it's something that goes around 80% with not much overlap. But in the blood, the problem is that, like, as most brain proteins, they are present in the blood in a much lower concentration than they are in the spinal fluid. So we need good technology to measure that. And right now we have a wide array of different analytical platforms to measure amyloid in the blood. And they all tell us around the same thing, that amyloid in the blood is only reduced by 10% in Alzheimer's patients. So it's a much tighter range of reduction than what we see in the spinal fluid. So on top of that, there is a complicating factor that more than thinking of, as you said, of amyloid that goes back to the central nervous system, it's important to consider that amyloid is also produced outside of the brain in the periphery. So we know that hepatocytes, which are cells composing our liver, and we know that platelets, which are part of our blood tissue that help us to coagulate, we know that amyloid in the same length as it is detected by Alzheimer's tests, they are to some extent produced in the periphery too. So what we've been discussing now is that amyloid in the blood is a test that has a robustness issue because the range is too low. So if you have, there will be always analytical error when you measure something. So if you change maybe a little bit your reagents and you have certain variation, then it's very easy to get to these 10%.
Right.
So
So
there's not necessarily good and bad. Yeah, go
right,
ahead.
right. Okay. So what I want to understand though, at this point, are blood tests diagnostic tools or are they just indicators saying, okay, you need more follow-up, you obviously have something, or can we actually diagnose Alzheimer's today with a blood test?
So I guess that to answer that question, we have to go to the controversial topic of defining what Alzheimer's disease are, right? Is what Alzheimer's
Yeah.
disease is. And there's a lot of debate. There are two main lines of clinical guidelines, and one of them points to a more biomarker-centered way of defining Alzheimer's. So from a more biomarker-defined perspective of the disease, which you do not take fully into account the clinical picture to define it, if you get a blood biomarker result that is indicative of an abnormality, then from that line of view, you will be considering that the person is within the Alzheimer's continuum. And in other ways of seeing it, like the other line of thinking Alzheimer's, it's a little bit against this biomarker focused way of seeing things, and in that case, you don't consider that just having amyloid is necessarily a problem. You understand that it puts the person at a higher risk, but you will only diagnose a patient with Alzheimer's disease when they present symptoms characteristic of the disease and have biomarker evidence. So I guess that to answer your question a bit more to the point, I think we have enough evidence as it is to say that the blood tests, of course, they're not widely available yet, but when
Yeah.
they are, they will become important tools in the diagnostic workup of Alzheimer's disease patients.
So, okay, um, the fact that now we have a blood test, and it's probably not 100%, as you're saying, diagnostic tool, but more like a risk assessment tool, right? To know who there's evidence of the pathology of Alzheimer's in the brain, but this is, people getting blood tests are probably among the earlier stage, healthier populations, at least in clinical research. That's how it's being used now, right? But but will we get to a point where we can actually take a blood test and say, oh, you have Lewy body dementia, or oh, it's Alzheimer's, oh, it's frontal temporal lobe dementia? Is there a way, as the technology improves and we discover new biomarkers, is that possible in future?
I guess that that is the dream of every neurologist. And so basically, right now we have reliable and good blood tests for Alzheimer's. We still don't have a good blood test for frontotemporal dementia, for Lewy body dementia, for vascular dementia. So what we think of with the blood biomarkers now is that an abnormal result indicates that you have Alzheimer's pathology in your brain, Alzheimer's pathology in your brain. And based on that information, the physician evaluating the patient, he will have he will be able to say with a good level of certainty then that the person has Alzheimer's pathology. But it's up to a more complex diagnostic process to determine if that is what is really contributing to that patient's syndrome.
Right.
I guess that the best analogy with this is that so dementia is the clinical syndrome, right? Dementia is when an individual has substantial cognitive impairment to the extent that his independence on daily life activities is harmed. He has less. The person has less independence. And Alzheimer's is one of the causes of dementia. And if we take fever as an example, we know that fever can be caused by a bacteria, it can be caused by fungi, it can be caused by metabolic problems, by viruses. So basically, and in some cases, these causes of fever can show up together. So with Alzheimer's and the blood tests now, when a clinician is evaluating a patient, he needs, of course, to do a thorough examination of the patient's clinical picture and understand with the information that the blood tests provide, because the blood test per se, it shouldn't be used to say, oh, you have Alzheimer's, that's the point, that's what you have.
Right.
No, the blood test will give you an indicative of pathology, and then the neurologist doing the diagnostic work of the patient needs to understand, okay, based on the patient's demographic profile, based on the history, the symptoms, do I think that this is a case where it's a typical Alzheimer presentation and that the pathology may be driving the symptoms? Or is it a case that maybe it's just a patient that, for instance, has a lot of cardiovascular problems,
Yeah.
and you can see that it has a lot of atherosclerotic plaques? So maybe that patient amyloid is just Alzheimer's pathology is just a coadjuvant. You know what I mean?
Yeah. So okay, Betsy has just asked a question. I think this is really relevant for a lot of people who may be watching this. She's asking, does evidence exist yet on how many years ahead of showing some symptoms the blood could show a positive result? That is 10 years ahead of observable symptoms, could blood tests be expected to show positive result? Because we know, and I know why she's asking this question, because we know that there's evidence that amyloid can be in the brain long before a person sees a symptom of the disease, right? So I've been told it's really in the inflammatory state. You have, first beta amyloid plaque, then tau tangles,
Yeah.
and then when the brain reaches a state of inflammation, that's when symptoms are happening. So to Betsy's point, would we be able to know 10 years prior to symptoms if we in fact are on the road to Alzheimer's before any symptoms?
Yeah. So I think that this is a very important thing to discuss, because this often when some research study points to something in those lines, we see very strong statements in the media and in the news about it. For instance, blood tests may detect Alzheimer's 20 years before symptoms and all that. But in real life, this is a little bit more complicated, because what do we see in the studies? The evidence indeed, it does suggest that these biomarkers start to increase for a number of years before symptoms onset. So, but the thing is that the studies, they work on a group level. So for instance, we see that there is a group of patients that are increasing their biomarker levels on average. And these average increases are happening many years before the symptoms. But these are on average. So there will be people there who will be with lower biomarker values. There will be people who will be in a gray zone. There will be most people getting abnormal, so to drive the average up. But I think that when the blood tests reach the clinic, what they will be able to tell us, I think they will definitely, alongside other important risk factors, such as family history, the age of the patient's cardiovascular health, and genetic information as well. The blood test will be another important element that will inform us on future risk. So, for instance, and this is an important disclaimer, I still do not hold my medical degree. I dedicate my life to studying Alzheimer's blood tests, but I'm still not a registered doctor. I'll be soon. But if I were in the future evaluating a patient, and the patient would have a series of risk factors and a positive blood test, I would understand that this is an indicative of greater risk, but it's not determinant,
Right.
because this is the tricky part of a disease like Alzheimer's, or like, for
Yeah.
instance, diabetes type 2.
So
They are.
how does it compare to so affirming, I mean, prior to blood tests, the two ways to really definitively diagnose Alzheimer's was through a PET scan, where you have dye and you can like look and see the plaques and tangles, or a spinal tap where they're taking cerebral spinal fluid, as you had mentioned earlier, and really looking for the biomarkers in that fluid. Now that's considered, prior to the blood test, like that was gold standard of Alzheimer's diagnosis, right? So my question is, are the blood tests as accurate as cerebral spinal fluid in determining, biomarkers?
So this is actually one of the areas in which I conducted what I consider to be, for the moment, my main contribution to the discussion with blood tests. So I think that we have enough evidence that points that there are good and bad blood biomarkers, not good and bad, but there are better performing and worse performing biomarkers. If you take the best performing ones, you will see that their performance is similar to cerebral spinal fluid and to positron emission tomography in detecting pathological changes. But I also do think that we've been working with spinal fluid tests since the mid 90s, and with PET since 2004 with amyloid PET. So we have a long history with these biomarkers. We know how to interpret them better. We know what may be affecting results. And blood is a little bit newer. And also, the blood is a more messy fluid, because you have a lot of things going on related to all your different organ systems in your blood. So much so that, for instance, the blood, you cannot see through it. It's red. You have to do a lot of centrifuging to separate different fractions of the blood. Whereas the spinal fluid, it is clear as water. So I think that we still need to know more about blood biomarkers in terms of their longer term operating characteristics. It's still something a little bit new. So what I
So
think
we need
we
more
have
data. We need more data then to understand the
yeah.
accuracy.
Yeah, but they do seem to be as accurate, or very close to accuracy. And what I think is a good approach in interpreting biomarkers to determine if a person has or not Alzheimer's changes, is because with the gold standard tests, the imaging tests and the spinal fluid, we tended to classify people into positive and negative. And we can do that with blood tests too, but with blood tests, we do have more overlap between the groups. And that's not just for amyloid that we mentioned before. Better biomarkers than amyloid in the blood, such as phospho-tau 217, also present a little bit higher overlap between groups in the blood than in the CSF. So one alternative that I'm very fond of is to understand that, like, okay, we know that the biomarker in the blood is reliable enough. We've seen a lot of data, but if we want to take a little bit more cautious and humble approach towards a technology that we don't have decades of experience with, we could have patients that are clearly abnormal, that are the patients that we know based on our research studies that are very likely to have Alzheimer's pathology in the brain. You can have those who are clearly negative, and then you have those in the middle where you have a little bit more of overlap. And then in these individuals, you could forward them to do a spinal fluid test or a PET
Right.
CT scan.
Right. So it's like for the first screen, maybe like aside from the cognitive assessment, maybe then we go
Yeah.
blood test and then, further confirmation. So, okay, I just have my last question is, the blood tests seem to be mostly used in the clinical sense. However, there are now neurologists and practices that are using them for diagnostic or at least risk assessment purposes. But my question is, like, is it really only plaque that's being used with blood tests, like as a biomarker target? Or, I know that tau was being developed, but is it currently being used, as far as you know, in terms of, even clinical or for clinical trials or actually in a clinic?
So as I was mentioning before, when I was talking about the challenges of measuring amyloid in the blood, this is one of the reasons that the field at some point started to invest a little more in measuring tau in the blood. So coming back to the disease definition, we know that having amyloid plaques is fundamental for you to be considered within the Alzheimer's continuum, but the amount of plaques you have in your brain is not so important to determine your cognitive symptoms as the amount of tau tangles that you have in your brain.
Is that because
So
tangles are a further progression? It means you're further into the disease?
yes, exactly. So then we had these two main targets, amyloid and tau. And we saw that measuring amyloid in the fluids was a little bit difficult. Even the best performing assays have important limitations. So the field invested a little bit more in trying to detect tau in the blood. And it was a fantastic surprise because so measuring tau in the blood, specifically phosphorylated tau, because this is the way that we see tau in Alzheimer's. Tau, let's think of our neurons as like they have a center, a command center, and then they have a big tail in which they will carry information to other neurons. And tau is the protein that acts as the stabilizer of these rails, let's say, as these rails. And in Alzheimer's, these proteins get hyperphosphorylated. A lot of phosphates are added to this, and what this causes is instability, and so you have neuronal dysfunction. But these phosphorylated tau species, they also leak to the fluids. So
Right.
in the end, we had a lot of success in the field with measuring phosphorylated tau in the blood. And then what does phosphorylated tau in the blood tells us? It will tell us, and 217, phosphorylated tau 217 is the most promising biomarker for clinical implementation. And people with elevated p-tau 217, they are likely to have amyloid in the brain, but not only that, a person who is amyloid positive but has more tau in their brain, they will also have higher levels. It will increase further up their phospho-tau levels.
So
it's not
is the P217, p-tau 217, because I've heard actually clinicians say they feel like that's like ones who have done studies and trials that it's a more accurate biomarker, they feel like.
yeah.
Is that measuring both amyloid and tau, or is it only tau? Is p-tau tau?
So Yes. So this is also a matter of a lot of discussion in the field. There are people who believe that tau increases in response to amyloid, and there are people who just think that
Right.
they are a little bit different processes and tau is still tau. But
Yeah.
from a clinical standpoint, I guess that the best way to synthesize what we have now of evidence is that both amyloid and tau in the brain contribute to higher tau levels in the blood.
Right. Okay, yes, that is really interesting. I mean, I guess as these tests become more readily available, as people use them more, or choose to, we're going to have a lot more data to really understand exactly what they can tell us. What I'm taking away from this is, it's a new technology. We know it's been used in trials. We know there's different degrees of accuracy. It's not a diagnostic tool on its own, at least
No,
right now.
no.
But it does help us create a better picture, especially for people who are earlier or maybe, have a relationship to the disease. It's just one more thing to check off to get more accurate diagnosis.
Yeah, exactly. And it's good because you're having like because all of the other things sometimes they feel a little bit
Right.
as I also have a person, my grandma has Alzheimer's, and as right now, without more technology, the further you get is a brain scan, and like you think, okay, I have a test for diabetes, I have a test for metabolic syndrome, for problems with lipids, and I don't have anything to check how the brain is working. So I think it's
Absolutely.
reassuring for both clinicians and for families of affected patients to also have something that gives you some direct information of what's going on in the brain.
Yeah, absolutely. And a comparison point. I mean, cognitive testing is like so subjective at times, right? And a person's cognitive scores can vary considerably depending on what day they take the test, in some
Yeah,
cases.
exactly.
So yeah, it's just another way to create a risk score and understand perhaps what's going on in the brain through the biomarkers. So thank you so much, Wagner Brum, for joining us and enlightening us with your expertise. This is an exciting area to look at. I think we still have a ways to go to really understand the accuracy and risk assessment, but it's good we have a new technology that's not invasive, right? It's a blood test is easy
Yeah,
compared to a PET scan or a cerebral spinal
it
tap.
it's still not very affordable. There's only
Yes,
a handful of companies doing it in the US, and sadly, they're still charging a lot. But hopefully, in the near future, more accessible technologies that are present in hospitals and general laboratories of hospitals, they will like these fully automated platforms that we call them, that are the same workhorses that measure your glucose, your lipids. Hopefully, soon we'll have blood tests measured in these platforms, which will make it also substantially more affordable.
that's a very good point. Thank you so much for joining us. And we'll keep an eye on this. Hope to have you back in future when we know more. But thank you for your research and thank you for taking the time to explain it to us.
Thanks for having me here.
And if you missed any of this interview, want to know more, don't forget to go to beingpatient.com. We've also covered this topic a ton. So look at the articles we've written. If you just search under blood tests, you'll see them all. Sign up for our newsletters if you haven't already. This is how you know about interviews like these. Thanks everyone for watching, and we'll see you next time.